Okay, this is my friend Brenna, my patient Brenna, and she's an athlete, a very athletic person and a trainer, and she has a historic knee injury that was improved, mostly improved. What would you say, 95% improved?
Absolutely, yes.
Yeah, and then it returned, and then she developed pain. It's not the original injury. She developed pain that we believe, she and I both believe, is related to a strain of the medial patellar ligament. And this developed after doing a lot of bicycling and then getting the kind of pedals with clips on them. And so what I'm doing here is, I'm getting a close-up now. So here's the knee, and the main area of focus is I've done these small needles underneath the kneecap into the attachment of the medial patellar ligament underneath the patella, and then at the same time the attachments of the ligament onto the femur. That's what I'm doing there, and those needles are in about 1 inch. And then at the same time I am deactivating the motor point of the Vastus Medialis, the VMO motor point right there. There we go. Let me adjust the camera. Sorry. The motor point of the VMO, because that muscle passes over this area, and we were both able to identify tenderness there. And at the same time, I'm also, for the same reason, doing the motor point of the gracilis, because the gracilis tendon is going to come over here and pass over and attach to the tibia, but the tendons passes quite close to where she feels pain on the ligament attachment to the femur of the medial patellar ligament. And then just to help open up the flow of chi out of that area, to give that stagnation a place to go, I've done these 2 points here on what happens to be the spleen channel, but it's got nothing to do with the physical spleen right here. And then, because of her historic injury involved the patellar tendon, I've also done the patellar tendon and a very famous point here on this tendon attachment here. So that's what I've done with the needles. I'm going to take them out now, and I'm going to do some moxibustion. And why am I going to do moxibustion? I'm going to walk over and get the moxa. Moxibustion is a Chinese technique in which we warm the acupuncture point, or the dry needling point, with an herb that in this case, the Japanese variety, they roll the herb up into these little stick-on things. And I'm going to, after I take out the acupuncture points, I'm going to come back. I'm going to turn the camera off and then make a second video of this. I'm going to warm the acupuncture point, the dry needling point, the ligament. I'm going to warm the ligament, and this has a very deep penetrating heat, and we like to use this in Chinese medicine, in Chinese acupuncture, with recent injuries and also old injuries both. Because life is a process of warm transformation, and heat is a way to promote the what am I saying? I'm failing here. Heat is not just heat, this very particular heat, it's a spicy herb, and so it has a counter-irritant effect. Kind of like if you put on Bengay, but it's a very penetrating heat, so it promotes circulation in the area. Let's put it that way. It's the same as using, in a way you could say it's the same as using ice, but it's the opposite of using ice. And anyway, some people really like it. Brenna does like it, so I'm going to do it in her case. And I find it a very effective for kind of arthritic injuries, and when someone's 41, and they have a long history of running and stuff like that, it's possible that there's some scar tissue, arthritic changes, and moxibustion is very good for that. So I'm going to turn this off and